Today we're going to talk about mock-ups. There are a few reasons to do a mock-up. The first one is when you're planning an aesthetic case. However, we also teach our students to do mock-ups a lot because it's a way for them to learn what teeth look like. So they learn how you shape teeth, where you put line angles and so on. And so you might think of it as the modern day version of doing wax-ups to learn shape of teeth. Now, when we're doing a mock-up, if you're doing it on a mannequin for practice, then you don't really have to put bonding agent on. And even on teeth, on natural teeth, if you're doing a mock-up. A mock-up is not a restoration, so you're not needing to worry so much about overhangs or interproximal ability to floss. You just want to have it stuck on so you can start to shape it. Now you'll notice that I have put a bit of bonding agent here on this plastic teeth just to help hold the mock-up on, because otherwise they can easily fall off when you're adjusting them. Now the finger is sitting behind the tooth to form like a palatal shell. So you can see I've got the finger sitting there behind the tooth. Now whether you use an injectable capsule or whether you are using a syringe and cutting little bits off doesn't really matter that much. I like capsules, but I know they're more expensive, so if you use a composite out of a syringe, totally fine. You'll also notice I use my finger a lot to pat the surface of the mock-up. So when you're doing a mock-up, you're not worried about contamination of the composite, or composite. So it's good to just use a finger to pat away at the tooth and shape it out. Now, you are going to do quite a bit of shaping in the shaping stage. So this particular part of the shaping you don't want to spend too much time on. So you really just want to get it flat with your finger and then use some sort of Tofflemire or, sorry, not a Tofflemire, use some sort of flat plastic instrument. Here I'm using a Style Italiano flat plastic because they're really fine, which I think comes from LM Art. Now, in real life, you can't usually just do a mock-up of 6 front teeth because they look too bulky and big. You really need to do a mock-up of 10 teeth usually, and certainly if you're getting a lab to do it, you want to use 10 teeth. But for a practice exercise on a mannequin, a lot of mannequins have small front teeth, so you can actually do a mock-up and not have it look horrendous. Now you'll see this there that I'm just getting a little bit of debris out of the mock-up. Normally when you're doing a mock-up, if you get a tiny piece of dust or something in it, it doesn't really matter. But because I'm going to film this and photograph it, I know dentists will go absolutely crazy if I don't remove these little bits and pieces. So that's why you see me putting so much effort in. Now here on this particular type of model, it's a Frassaco teeth model. So Frassaco teeth, the standard arrangement is that the front teeth are shorter than the back teeth. And so you can actually do quite a big mock-up and have a nice harmonious smile line without having to do the back teeth. Now, once I have that mock-up in place, so it's kind of rough, you get it roughly in place. You don't want to have too much bulk, but you get it roughly in place. The first step is to get the incisal edges done. Okay, then we do the interproximal lines. You'll notice I'm not trying to make these lines curved at this point. They're literally just straight up from the interproximal, from the gingival embrasure up to the incisal embrasure. And you have to stand up often over the top of the model so that you really can see this as a straight line. And then we're going to flatten the front. So this is step 2. So we get the incisal edge, straight lines, and then we flatten the front. Don't try and make the tooth round at this point. So today someone said to me, why does my tooth look bad? And I said, it's because you tried to make the tooth round at the start. At the start, you make the tooth really flat. Flat on the edge, flat on the face, with crisp lines. Now we're starting to outline the line angles. So first, we're going to flatten the area between the line angles to get this flat surface, like really flat. Not, there's a little tiny bit of curve to the gingiva, but generally it's really flat, not curved. So this is where people generally go wrong with these restorations, is they're trying to make the tooth look curved from the start. Teeth have a lot of definition. They're basically flat with round corners. And so if you try and make them curved at the start, they end up looking blobby and fake. Okay, now you can see that I've drawn in the line angles, and after flattening the face, now I'm starting to cut from the embrasure to the line angle. So I'm removing all of that bulk from right into the interproximal embrasure all the way to the line angle. Okay, and it's a lot of material, and it should really open up the space between the teeth. This is what makes teeth not look fake and make them look individual and separate. Now, if you look carefully, you'll see that I've actually cut a very flat surface from the line angle all the way interproximal. So it actually goes almost to the contact point on a real tooth. Then we re-outline our lines just to give us guidance, because it's hard to see what you're doing otherwise. And we really get those areas nice and deep. And you can see how much I'm taking that bulk off the distal of the lateral. So the lateral incisor has this bulge normally, and you have to remove that bulge on the distal, otherwise the teeth kind of look like they're joined together. So you can see I'm putting a lot of effort. And also notice how narrow the line angles come in on a lateral incisor. So we really want to narrow the face of the tooth down towards the gingiva. And you can see how on the central incisors, it's fairly wide at the gingival. On the lateral incisor, it's narrower. And on the canines, it comes all the way into a V shape. On the canine, you've kind of got 4 planes. So you've got the distal plane, which is outside the line angle. You can see me smoothing it here. You've got the mesial plane, which I'm using a fine burr, which is on the, from the mesial line angle into the interproximal. Okay, and then we do the face of the tooth, which has 2 planes as well. So you've kind of got the slightly mesial one and the slightly distal one. Okay, at this point, we can do a little bit more shaping of incisal edges if we need to, but it's better if you leave it to the end. If you try and get out of order and do things without going step by step, you tend to end up being inefficient. So now we're doing the same thing on the other tooth. Okay, we're also opening up the incisal embrasures a little bit. And it's not just about opening them up from the incisal to the gingival, but it's also from the buccal to the lingual. So the canine, if you look at the canine on the right-hand side of the screen, you'll see that the incisal embrasure is really open. But on the left-hand side of the screen, the 2-3, you can see that there's a lot of lingual bulk, and that's filling in the incisal embrasure. So once we get those surfaces flat and the embrasure is more or less in the correct spot, now we're going to do some surface texture. Now, teeth come in all sorts of different shape and sizes, so how you do the texture is up to you. You'll notice here I'm kind of doing quite a wide, shallow V, so it actually, often what people do is they try and cut a groove, but what we're not trying to do is we're not actually trying to create a groove in the tooth. We're trying to create high parts. Now, we can't print the tooth to make high parts, so the way we make high parts is making other parts lower. So think of making some high parts with a lower bit in between when you're adjusting, rather than just cutting a groove in the tooth. So you'll notice that rather than just doing a burr mark, I'm flaring out that groove from side to side. So once I've got the rough shape in, I'm now just going to do a quick polish, and we'll see how things look. So often just to get some idea of the texture. Now, what happens is if you've got everything nice and flat, you've cut all of the angles really, really sharply, so everything's super flat, and then you put your texture in. When you do the final polish on composite resin, it will round over the corners, and so then it will naturally become rounded on the corners. So you don't need to try and start rounded, because if you start rounded, by the time you finish polishing, it's like blobs. So you want to start with your tooth really, really with sharply defined angles, and then when you do all the polishing, it will look rounded on the corners. So you'll notice that I did a very quick bit of polishing with a wheel at the start, just so I could see what was going on, and now I've gone back and done a whole bunch of polishing with some cups to get it a lot smoother, particularly interproximal. Now I want some texture, so I'm using a slow speed diamond burr here, and I'm just going to go backwards and forwards from side to side to get some sort of texture on the surface there, and I'm going to touch up the buccal surface shapes a little bit more. So often you have to get the tooth quite polished so you can see the shapes, and then you can make a decision on whether you're going to refine those shapes. So here I've decided the shapes were not pronounced enough, so I'm going to do a bit more. And yeah, you can do often those those wheels with the little fingers of polishing material, like the Ivoclar wheel, which is the blue one you see me using, are really good for doing a quick polish, so you can see how the texture and shapes look. Now, once you want to do your final polish, you don't want to go through all of the steps of polishing, because if you go through too many steps of polishing, you'll actually polish all the surface texture off. So the way you get pretty texture is by having texture on the tooth and then polishing it really heavily, but usually you're skipping some of the polishing steps along the way. So that gives you that kind of texture, but shiny texture. If you go through all of your polishing steps at this point, then you'll end up with a tooth that's bland and has lost all of the texture. So with that polishing step, you can see we kind of go through a very rapid initial polish so that we can see the tooth, see some of the texture on it. And then we go through a full polish, check the shapes and textures, reapply shapes or textures as necessary. And then the final polish is just using your fine polishing wheel with high speed, fairly firm pressure, going over it fairly heavily, but it's still only the fine one. So it will leave the texture there, but it'll just make the texture glossy. Thank you for watching. If you've enjoyed this, please tell your friends. If you want to upskill and learn these techniques yourself, go to RipeGlobal.com and check out the Fellowship of Restorative Dentistry.